Hi, my name is Kevin Brandt. I'm an intern pharmacist at California North State University College of Pharmacy, and today I will be going over shock syndrome. Okay, so what is shock? So the definition of shock is it's inadequate blood perfusion or blood supply to organs and tissues. This is a medical emergency. It is life-threatening and requires immediate hospitalization. Um, Shock is very life threatening because if you have inadequate blood perfusion or blood supply to an area, this can cause reduced oxygen supply to vital organs, which can lead to organ failure, and organ failure can lead to death. So, shock is a very emergent situation. And there are a few different types of shock. So, first, there's hypovolemic, which is pretty much a low blood volume. There's cardiogenic shock, which is due to some underlying heart condition. There's also obstructive shock, which is due to some type of blockage or embolism. And lastly, there's distributive, also known as vasodilatory shock, which has multiple different causes. So, signs and symptoms of shock. So, it kind of depends which type of shock is manifesting, and it's also important to know that multiple types of shock can occur at one time. However, there are a few general signs and symptoms for the majority of shock cases. So, first would be an altered mental status or confusion. A patient might come in very confused, not well oriented. This could indicate possible shock. Another thing that a lot of shock patients have is cold, clammy skin, where their skin will be, or extremities and skin will be very cool, but they also might be kind of clammy or wet due to the shock. An exception for this is sepsis, where the patient would actually be warm to touch due to an infection and rise in body temperature. Other things that you could see in shock are worsening kidney function. So if you were to look at some of the laboratory values, you would see an elevated serum creatinine or BUN, and you'd also see a decreased urine output, which is called oliguria. You can also see worsening liver failure in shock. So you can see someone's labs maybe with elevated liver function tests or liver function enzymes, AST, ALT. And you can see they might be at more risk for clotting, coagulopathy, due to this liver injury. Okay, so now some signs and symptoms more related to each individual type of shock. So if there's hypovolemic shock, it can be caused by a hemorrhage or blood loss. This could be due to trauma or surgery or some type of injury to the body. Or there can be a non-hemorrhagic cause, such as dehydration, which can be due to excessive vomiting, excessive diarrhea, or even heat stroke. The other type of shock, cardiogenic, this is resulting from reduced cardiac function or underlying cardiac disease. Some examples include acute decompensated heart failure, myocardial infarction or heart attack, valvular disease, or arrhythmias. For obstructive shock, some signs and symptoms could be if you notice a pulmonary embolism, cardiac tamponade, or tension pneumothorax. And lastly, distributive or vasodilatory shock. The main three causes for this one include infection or sepsis, and sepsis is actually the most common type of shock in general. There can also be anaphylaxis or allergic reaction, or a neurogenic cause such as trauma to the brain or spine. Okay, so what is the treatment for shock? So the general approach for treating shock is we want to maintain a mean arterial pressure or MAP above 65 millimeters of mercury, or SBP or systolic blood pressure above 90 millimeters of mercury. These labs are very important because when we're above these labs, that means we are maintaining adequate blood perfusion and delivery of oxygen. If we are below these values, then that means we are not delivering enough oxygen to tissues, which can again result in organ failure and death. So that's kind of the general approach. Then to further guide treatment, you can look at each category for how to treat them. So hypovolemic shock, if you have hemorrhagic or blood loss type of shock, the go-to treatment is blood transfusion. If there is non-hemorrhagic shock or resulting from fluid loss, the mainstay of treatment is normal saline or lactated ringers because these are cheap and they're readily available. You can also use albumin 5% or 25%. However, this is more expensive and might not be as readily available. And there's actually studies showing that normal saline or lactated ringers are just as effective as using albumin. If there is a cardiogenic cause of shock, the way we treat this is you have to treat the underlying cause. So, for example, if someone is having a myocardial infarction or heart attack, we want to treat this cause first by doing strategies such as reperfusion, by doing maybe a PCI or percutaneous coronary intervention or CABG, coronary artery bypass graft. Also, there can be acute decompensated heart failure as a cause for cardiogenic shock. Treatment for this type of condition revolves around using diuretics for any fluid overload or ionotropes such as dobutamine, which is one of the medications in the middle of the screen, or milrinone, which can be treatments for acute decompensated heart failure. So you kind of want to treat the underlying cause in cardiogenic shock while also making sure that the patient has a mean arterial pressure above 65 or a SBP above 90. Okay, so how do we treat obstructive shock? So the main treatment for this type of shock is we need to remove the obstruction. That is first and foremost, and then we can use fluids or vasopressors if needed to maintain the MAP above 65 or systolic blood pressure above 90. And when I refer to fluids, I'm talking normal saline or lactated ringers, and vasopressors are norepinephrine, epinephrine, or vasopressin. When treating distributive shock or vasodilatory shock, it depends on which condition or cause the shock. So if there's sepsis, and sepsis is the most common shock out of all the shocks that I've talked about today. So sepsis actually has its whole own guidelines for how to treat it, but a little brief overview is first you administer broad spectrum antibiotics such as Rocephin or ceftriaxone, which is the picture on the screen. You give a broad spectrum first until you get labs back that would narrow down which organism is actually causing the disease, and then you give a more specific antibiotic. Mainstay treatments for sepsis shock also include fluids and vasopressors, and as a last line resort, you can also use corticosteroids. Anaphylaxis or an allergic reaction. The mainstay of treatment for this type of shock is vasopressors, fluids, or antihistamines, and corticosteroids. And lastly, neurogenic cause. You want to first try to restore whatever happened in the brain or spine and treat with vasopressors or fluids to maintain the MAP or SBP. Okay, so how do we monitor shock? First and foremost, you need to monitor the patient's vital signs. You can do this using an electrocardiogram or ECG and any telemetry equipment. You also need to monitor the MAP or mean arterial blood pressure. Remember, we wanted that above 65 millimeters of mercury, or the systolic blood pressure above 90 millimeters of mercury. You also can monitor the patient's heart rate. It's very important that we monitor the medications that are being administered. So make sure that the infusion rates are correct and right dose, right rate. Also monitor for extravasation, which is pretty much when you insert an IV and maybe it isn't inserted correctly or it falls out and then it leaks into areas outside of the blood vessels. So we need to watch for this. Also, you need to look out for any medication-specific adverse events that might cause more harm to the patient. Okay, so how to prevent shock. So shock can result in, as we know, a lot of different ways, but here are just some general recommendations to help prevent shock from occurring. So first and foremost, a healthy lifestyle to maintain good cardiovascular health. This can be done through a balanced diet, exercise, and medication adherence. Another way to prevent shock is by preventing any injuries, wear safety gear or equipment when playing sports or operating machinery, and to have first aid supplies available. It's also important to avoid any allergies that you may be allergic to, and it's always good to drink plenty of water. And lastly, if a patient's already hospitalized, make sure to remove any medical devices as soon as possible. Examples are respirators or catheters because this can cause an infection. Thank you so much for listening today. I hope you learned more about shock.